Yes, everyone. Very good evening to all of you. So this time in FMG exam, like from forensic, almost 14 questions were asked, and from psychiatry, they have asked 7 questions, right? Let's see all the questions one by one. See, first question, very easy to understand. I think we have learned all these with the help of so many pictures also. See, first question, a hammer fell on the head of a worker when he was working with his friend at a construction site. Which type of fracture is seen as per X-ray image? Okay, see here. So almost a similar image they have asked in the exam, right? Okay, chalo, let me show you some pictures which I have shown you before. See here, I have taught you that if there will be only linear fracture, then it will be called as fissure fracture. If you can see a depression here, right? So a kind of depressed fracture, right? After seeing this photo, you can understand that which weapon was used. So I taught you that, okay, see, here you can say okay, hammer. Hammer has given its signature, right? Signature fracture, or you can say a depressed part, it is called as depressed fracture. So here your answer will be out of these four options, answer should be depressed fracture, right? So linear fracture we have learned. If there will be hole in between, right? So that will be called the gutter fracture. See, hinge fracture means what? See, hinge fracture means what? Like suppose if there was a bike rider who was riding bike very, very fast. Suddenly, after skidding of bike, what happens? So when he will be skidding on the road, there will be force from the lateral side, right? Now head can get, see, a skull can get divided into two half, right? So there can be nodding face sign, right? There can be nodding face sign like a hinge. So that is hinge. Okay, this photo here answer is depressed fracture. All right. Now, see here. So this time from the medical jurisprudence, they have asked so many questions, right? From the medical jurisprudence. See this question and now you try to answer. Yes, good evening. Good evening, everyone. Dr. A, Dr. Shahab Ali. Yes, good evening. Okay, see this question and try to answer now. A middle-aged person from the nearby village was assaulted by 4 to 5 people. Okay, and brought to hospital in a serious condition. His dying declaration was being taken in hospital. Which of the following is a right statement regarding the process? So see here, we have learned in detail how to differentiate dying declaration and dying deposition. See here, dying declaration, when a person is about to die and he wants to give any statement, right? He wants to give any statement. Yes. See, ideally this should be recorded by magistrate, but at that time you don't have that much time. So who can record? Anyone can record. It can be recorded by anyone. Even a doctor can record, even a police can record, even village headman can record. But recording should be done in front of the two witnesses. Okay. So like when a person is about to die, are you going to ask him to take oath? See, like it is assumed that a dying person does not lie. So no oath will be taken. And after that, no cross-examination. Are you going to ask any leading question? Obviously, no. But doctor has to certify that, yes, before giving a statement, he was completely oriented. Yes. So it will be there. Are we practicing in India? Yes, we are practicing. So here the question was asked for dying declaration, right? See, now you tell me here, which of the following is a right statement related to this? Oath is compulsory before taking? No. Only police has authority to record the statement? No, anyone can record. Oath is not taken? Yes, this is a right answer. Leading questions can be asked? No. Leading questions cannot be asked. So answer is C here. Next question. Yes, this time see here from last year, 1st July 2024, we have started practicing new laws, right? Earlier it was IPC, now it is BNS, Bharatiya Nyay Samhita. Earlier it was CRPC, now it is BNSS. Okay, Bharatiya Nagrik Suraksha Samhita, right? A woman died after 3 years of marriage. The case was reported by the police by her father. See, inquiry in this case will be done under. So if there is a case of dowry death, right, inquiry will be done by, inquiry will be done by, police inquiry will be done or the magistrate inquiry will be done. Remember, say here, so magistrate inquiry will be done, right? Magistrate inquiry will be done. Magistrate inquiry. So can you tell me inquest? I have taught you, like when I talk about, say when I talk about police inquiry, right? A police inquiry. Earlier, CRPC 174. And magistrate inquiry, earlier CRPC 176. 6. But what about BNSS now? Remember here, new law, BNSS number 194, right? That is police inquiry, and 196 BNSS. Okay, so that will be okay for magistrate inquiry. So here answer will be B. Remember, so now they have started asking new laws. So whatever we have learned before, please revise everything. We should be expecting new laws now. Okay, right? 196 BNSS will be called as what? Magistrate inquiry. Next, a skull bone was brought by the police for forensic examination. Cephalic index comes out to be 85. Skull bone belongs to which race? Okay, we have learned that there are different types of race. First of all, it is called as Caucasoid, Mongoloid, and then Negroid. See, in Caucasoid, European and Chinese, Mongoloid, Japanese and Asians, Negroid, Africans and Aryans. What is the best bone to determine a race? Okay, skull bone, right? A skull bone. What is the best bone to determine sex of a person? Hip bone. Okay, hip bone. Easy to understand, right? So now, what is the best bone to determine height? Femur bone. Now let's learn about the races here. Race can be determined that, see, the best bone is skull bone. For this, see here, with the help of skull bone, we calculate one ratio that is called as cephalic index, where we have to see here maximum breadth of the skull will be divided by length of the skull multiplied by 100. Say here, from anterior to posterior part, this is called as right length, and left to right, this is called as breadth. So see, when I show you this one, see, dolichocephalic means what? See, remember here, when, see here, यहाँ पे this is the breadth and this is the length. When denominator is more, ratio will be less. So this will be coming as 70 to 74.9. Okay, this is called a dolichocephalic, Aryans and Negroes. But look at the second photo here. Here you can see, this is actually what? This is actually breadth and this is a length. Here almost equal. So here ratio will be more. So when a ratio will be coming as 80 to 85, then, okay, see, brachycephalic, mongoloid. In between 75 to 79.9, mesatecephalic. So there are three cephalic indices: dolichocephalic, mesatecephalic, and brachycephalic. Right? Easy to understand? Remember, all these points are clear to everyone? Right. So now in this question, examiner has mentioned here that cephalic index was found to be 85. So here answer will be mongoloid for sure. Now you can ask me, sir, what about Indian population? Which type of skull we have, right? See, Indian population, most of the features we have of caucasoid with the negroid. Okay. Out of these three, we belong to mesatecephalic. Okay. Next question. Leading questions are allowed during. See here, actually this is repeatedly asked question. Okay, fine. See here, leading questions means what? What is the meaning of leading question? Where answer is expected to be only in yes or no. Yes or no. Suppose if advocate is asking any question, like to a witness when he is standing in the witness box, like, did you see the murder? Yes, sir. Okay, length of sword was 40 centimeter. Sir, actually, I saw from the... No. Answer me yes or no. No, sir, actually from yes or no. So where answer should be only in yes or no, that is called as leading questions. I have taught you this in detail. So yeah, first of all, oath will be taken. and then examination in chief. Then after that, there will be the cross-examination and re-examination. Remember, there will be, see here, remember, there will be two advocates. One who is fighting for the victim will be called as a public prosecutor, and the advocate who is defending, right? Okay, he will be called as a defense lawyer. Suppose if there was a witness who was invited by public prosecutor, so see, a first examination will be called as examination in chief, which is also called as a direct examination. Okay, so first question will be asked by the first side same side lawyer. Okay, same side lawyer. After that, after the defense lawyer can do the cross examination, then a re-examination will be done by the same side lawyer. Please remember here, leading questions are allowed only during the cross examination. I have given you the example also, if you are able to recall. Same example I have given during the class also. Very famous movie, right? Very famous movie name was Damini. Okay, she was the main eyewitness in a case of rape, and he was Mr. Shekhar, right? Mr. Shekhar. He was Mr. Chadda. He was Mr. Chadda. Okay, so here Shekhar was, he was public prosecutor, and Mr. Chadda was a defense lawyer. So the case will be started. See, the questioning will be started by Shekhar. So Shekhar can do chief examination. After that, Mr. Chadda will be doing the cross examination. Now, Mr. Shekhar will be doing re-examination. Question is that who can ask leading question? Only Mr. Chadda. Only Mr. Chadda. Right? We have learned all these. Easy to understand? Remember here. So leading questions are allowed during the cross examination, hostile witness, and dying deposition. During dying deposition, it is allowed, but during dying declaration, during direct examination, re-examination, leading questions are not allowed. Okay, so what is the answer here? Out of these four, yes, answer will be C here. Leading questions are allowed during the cross-examination. Next question. In a case of dowry death with recent history of dowry demand, inquest is done by. Simple thing is that we have learned that, see, one is called as the police inquest, another is called as magistrate inquest. Okay? In a case of murder, in a case of rape, in a case of suicide, homicide, or if there will be death because of machines or animals, police inquiry will be done. Police inquiry will be done, right? But what if a death has happened during police interrogation in the custody, right? Then at that time higher authority should come, right? Magistrate inquiry should be done. Okay, we have learned that magistrate inquiry, A, B, C, D, and E. A for if death has happened in asylum, means psychiatric asylum, psychiatric hospital. B for Borstal death. Okay, what is the Borstal school? Jail for juvenile. C for custodial death. C for custodial death. And D for dowry death. E for exhumation. E for exhumation. Exhumation means what? What is the meaning of exhumation? Digging out the dead body from the grave. Okay. So remember here, in all these cases, magistrate inquiry will be done. Okay. Magistrate inquiry will be done. We have learned that one is judicial magistrate, another is executive magistrate. See, executive magistrate, their main work is to maintain law and order, and judicial magistrate can handle all the cases. Remember here, judicial magistrate can handle all the cases, but executive magistrate like deputy collector and collector, revenue divisional officer, and tahsildar, they can, see, they can handle the case of only dowry and exhumation. Dowry and exhumation. Easy to understand, right? So here answer will be B. Chalo. Being a doctor, you have received a summon from district court to record your evidence in a criminal case. But 2 days back, you already have received a summon from a civil case. Civil case in district court of same date. What should you do now? See, we have learned this in detail also. Higher court will be having authority over a lower court. Suppose if you are getting someone from the two different courts, okay, from two different courts on the same day, you have to attend higher court. Simple logic is that you have to attend higher court. Here, if there was a case of civil case and a criminal case, you should be attending the criminal, right? Now, remember here. So answer will be B. Very easy to understand. Remember here, if there was a someone from, like session court and second class judicial magistrate, then you had to, like you were supposed to attend the session court. So simple logic is that higher court will be having authority over the lower court. If there is a case of civil court and the criminal court, obviously you have to attend the criminal court first of all. Okay, you have to attend the criminal court. Simple. Next, see, the corneal transplantation can be done within how many hours of declaration of death of a person? We have learned that, see, sudden, when there'll be a stoppage of heart, brain, and lungs. Okay, clinical death, which is called as somatic death. Somatic death. During somatic death, aerobic processes will be stopped. Aerobic processes will be stopped. But anaerobic processes will still be working. Anaerobic processes will still be working. Okay, it will still be working. So, but like after a few minutes to few hours, now each and every cell of the body will be dead. Now it will be called as molecular death. Molecular death. Period between somatic death and molecular death is called as supravital period. Supravital period. During this period, we can harvest the organ for organ transplantation. We have learned this. Remember here, see, molecular death period of a renal, see that kidney, after 1 hour a kidney will completely be dead. So if you have to harvest kidney for kidney transplantation, you have to harvest within 1 hour or less than 1 hour. Heart will completely be dead after 45 minutes. See, liver will completely be dead after 15 minutes. Earliest organ to die after the death is, see, nervous tissue within 5 minutes. A cornea will completely be dead after 6 hours. So if you have to harvest cornea for the transplantation, then it should be done within 6 hours. Okay, within 6 hours. Very easy question, I will say. Very easy question, right? Okay, next question. Now you see here. A young man got stabbed on anterior thigh and was brought to emergency room. He died shortly after arrival and his body was taken for postmortem. Entry wound was seen. First of all, stabbed on anterior. Here, examiner is mentioning only entry wound. See, examiner is not mentioning the exit wound also. So which type of injury is this? If you are able to see same photo I have shown you during class also, if you can see only entry wound, it will be called as penetrating wound, right? Penetrating wound. But if you can see entry also, exit also, then it will be called as the perforating wound. Okay, stab injury means what? Sharp and pointed weapon, right? We have learned all this. So answer will be here. Answer will be, okay, penetrating injury, right? Penetrating injury. All these points are clear to everyone, right? Now, see this question. A person is presented with brownish scab over a wound with the history of injury after fall from a height. What is the estimated time of injury? Here, like examiner is talking about what? Abrasion. We have learned. Suppose if you see after the injury, if you see red, I will say fresh red. Fresh red. If you can see red, see here, red scab. Red scab. If you can see reddish brown scab, reddish brown scab, if you can see brown scab, and then black scab, right? All these points are easy to understand, right? See here, see the black scab will be seen, okay, just after 7 days. Okay, see here, or on 7th day. See the brown scab here, 5 to 6 days, and a reddish brown, 4 to 5 days. 4 to 5 days. Red scab over abrasion. See, Abrasion means what? After blunt trauma, after blunt injury, if there will be superficial rupture of epidermis, right? No, so there can be minor or there can be no bleeding. So that is called as abrasion, right? Abrasion, right? Very easy to understand. Okay, fine. See here, now red scab you can see in 2 to 3 days and fresh red, right? No, fresh red. Like remember here, fresh red, I will say ki up to 12 hours, up to 12 hours. Okay, see here. Now see these like these two you can see up to the 3 days. But when you see 100% fresh red, right? 100% fresh red, right? So this will be like less than that 12 hour, less than that 12 hour. When I talk about brownish scab, no, see here. So this was 100% see a fully brown or reddish brown it was mentioned, right? It was fully brown or reddish brown. See, I will say like suppose if examiner has mentioned, see here, see the brown scab or the reddish brown scab. Out of these four, no, see better answer is C only. Better answer is C only. Okay, see here now examiner has given a kind of like a 12 to 24 hours, 48 to 72 hours, or 4 to 5 days, right? Or more than 7 days. After 7 days, see the black scab will be peeled off without forming any scar, right? So here answer will be 4 to 5 days only. What about this one? RTA patient brought to emergency room. On examination, he was mentally confused. He was able to localize the pain and he was opening eyes on speech. What is the correct GCS calculation here? GCS score. See, remember here, like I have taught you in the first chapter only how to calculate GCS. Okay, how to declare a person in, how to declare a person as the brain dead, as brain dead. Okay, remember here how to declare a person as brain dead. Remember, see, when I have to declare a person as brain dead, when I have to declare a person as brain dead, first of all, that person should be in coma. There should be absence of, there should be absence of of the brainstem reflexes, right? Reflexes like the pupillary reflex, corneal reflex, pharyngeal reflex, oculovestibular reflex, and there should be signs of destruction of the brainstem, right? How to declare a person in coma? For that, we have one scale that is called a GCS scale, okay, Glasgow Coma Scale. We have learned this. So we have to check eye response, verbal response, and motor response. Eye response में if patient can open his eyes spontaneously, if patient can open his eyes spontaneously, I will give him 4 marks. After road traffic accident, suppose if a patient is on a stretcher, if he can open his eyes spontaneously, 4 marks, right? But suppose if his eyes were closed, I asked him, hey, open your eyes. After the speech, if he is opening, no, then I will give him only 3 marks. Only 3 marks. Okay? Suppose even after my instruction also, he's not opening the eyes. So I can see that he was having a wound over his shoulder. Whenever I'm going to push his wound, whenever I'm going to press his wound, after that he's like, who is here, man? Right? After the pain, then 2 marks. No response, 1. Now, what about a verbal? If he is 100% oriented to time, place, and person, I will give him 5 marks. If he appears to be mentally confused, 4 marks. See, suppose if he is using inappropriate words, right? Suppose if I asked him where it happened, he's saying what? Andhra Pradesh, Mark Zuckerberg, Facebook, Instagram. Or suppose if he is abusing doctor, inappropriate words, I will give him only 3 marks. Suppose whatever he is saying, I'm not able to understand. I will give him only 2 marks. No sound, 1. Okay, next. Now, what about the motor response? Suppose if he is obeying my command, I asked him to move like this and that, 100% movement, he is obeying my command, 6 marks. He is not able to obey the command, but he can localize the pain. I will give him 5 marks. He is not able to localize the pain, but see here. Now, suppose if he was having a small wound here, whenever I'm going to press his wound, he is having what? See, the normal flexion. I will give him 4 marks, right? But abnormal flexion, I will give him only 3 marks. Okay, see, abnormal extension like this, I will give him only 2 marks. No movement, 1. Okay. See, total score is 15. Minimum score is only 3. When will you declare a person in coma? When score will be in between 3 to 8. Score will be in between 3 to 8. Now, you see this question here. See, he was appearing to be mentally confused. He was able to localize the pain and he was opening his eyes on speech. So can you tell me how much will be the score? After speech, mentally confused, he was able to localize the pain, right? So answer will be what here? Right, answer will be 12. See, GCS score, yes. All right, ठीक है, चलो fine. Next question. A body brought for autopsy was cold and had developed rigor mortis in all 4 limbs. And after that, after the liver mortis was seen at back. And there is no sign of putrefaction. What is the estimated time since death? Okay, here examiner is mentioning that there is complete rigor mortis. Okay, and liver mortis at back. No sign of the putrefaction. So first of all, for rigor mortis, I will say rigor mortis, rule of 12. Rule of 12 we have learned. Rule of 12. See, it takes approximately 12 hours to appear and 12 hours to persist and 12 hours to disappear. First of all, means up to 12 hours. Fixation of liver mortis means after that there will be no shifting of blood. Fixation of liver mortis also happens in 6 to 12 hours. 6 to 12 hours. Right now, after 6 hours only. So out of these 4, best answer will be 6 to 12 hours. Here you had to apply your common sense. See, basic knowledge with common sense, right? 100% you can solve the question here. Okay. Which type of hypoxia is seen in phosphine gas poisoning? Okay. See, phosphine is related to aluminum phosphide. See, phosphine. So this is going to block cytochrome oxidase. Cytochrome oxidase enzyme. I have taught you when I have taught you about liver mortis. Okay, different color, right? Liver mortis. CO poisoning, we have learned about CO poisoning. And then that time I taught you about cyanide poisoning also. Cyanide poisoning also. 4 types of hypoxia I mentioned. Like there was hypoxic hypoxia, anemic hypoxia, and after that hypoperfusion or stagnant hypoxia, and then histotoxic hypoxia, histotoxic or cytotoxic. CO poisoning may, see, CO poisoning, remember here, when person is alive, there will be oxyhemoglobin. But when CO is going to enter the body, CO is going to enter the body, no? CO will take hemoglobin away from the oxygen. Now there will be deficiency of hemoglobin. So I can say that in a case of CO poisoning, there will be anemic hypoxia. But cyanide was blocking cytochrome oxidase enzyme. In the same manner, phosphine. So this was also, see here, so this is also blocking cytochrome oxidase enzyme. See here, in a case of this, now what will happen? Now the tissues, see, they are able to utilize the oxygen only with the help of cytochrome oxidase. But when this will be blocked, no, now, so there will be, so now there can be histotoxic hypoxia. And in a case, remember here, answer will be what? Histotoxic hypoxia. Histotoxic hypoxia or cytotoxic hypoxia. Now, see this question. A patient is brought to hospital with diarrhea, bradycardia, muscle weakness. On the basis of symptoms, he was diagnosed to have OP poisoning, organophosphate poisoning, for which atropine was given. Which of the following will not be affected after atropine administration? See here, OP poisoning case. OP poisoning case here, OP poisoning, right? OP poisoning. See, examiner is mentioning after giving injection of atropine, after atropine administration, which of the following will not be affected? I hope you are able to recall that atropine will be affecting only muscarinic part, not the nicotinic part, not the nicotinic part. Now, out of these, can you tell me which one is the nicotinic part? Remember, you see the bradycardia, muscarinic, nasal discharge, sweating or diaphoresis. All these are related to muscarinic, but nicotinic is what? Muscle weakness, right? No, this will not be affected by the administration of atropine. Now, see here, so I hope you have done a good job in forensic, because I feel paper was easy. In forensic, actually, paper was easy. Psychiatry may they have asked 7 questions. Psychiatry, I feel के easy था इस बार. ठीक है, देखो क्वेश्चन पढ़ो. A 45-year-old man, a 45-year-old man presented to hospital with complaints of seeing snakes crawling, and an inability to recognize his own family members. Means there was a disorientation, mental confusion, and tactile hallucination. You can say seeing, visual hallucination. He reports his last alcohol intake was 48 hours before. What is the most likely diagnosis? Alcohol withdrawal symptoms I have taught you in detail. If a person has stopped taking alcohol for last 6 hours, more than these, see, more than the 12 hours, more than 24 hours, and more than 48 hours. More than 48 hours. What is the first symptom you are going to see in alcohol withdrawal? First symptom will be tremor. More than the 12-hour alcoholic hallucinosis. Means there will be auditory hallucination, right? Okay. And more than 24 hours, there will be seizure. And more than 48 hours, there will be, now situation will be serious, right? There will be complete disorientation to time, place, and person, with visual hallucination, tactile hallucination, auditory hallucination. This is called as delirium tremens. Okay, fine. I hope you have marked it correct, because it was easy question. See, delirium tremens is an emergency. If you do not treat on time, mortality rate will be, see, mortality rate will be 20%. So how to treat delirium tremens? You have to give injection of, benzodiazepine with vitamin B1. So how to treat delirium tremens? You have to give injection of lorazepam with vitamin B1. Question they are asking, why vitamin B1 injection is mandatory? Because see, if you are not going to give the thiamine injection, no, it can lead to one more emergency. Okay, Wernicke's encephalopathy. So to prevent Wernicke's, we have to add vitamin B1 at any cost. Okay, next, a 24-year-old male previously diagnosed with a psychiatric disorder, has become very aggressive with his neighbors, speaking rapidly and sleeping very, very less. He also exhibits hyperactive behavior after discontinuing his prescribed medication. What is the most likely diagnosis? See, schizophrenia? No. Depression? No. Substance induced mood disorder? First of all, do understand, he is a young male. First of all, a young male. When he is hyper, he is speaking a lot, right? He is speaking a lot. He is sleeping very, very less. So this is nothing but mania only. This is a case of mania. So answer will be here. Simple question. I will say that directly you could have marked this like answer here. Bipolar case or mania case. Simple logic hai, right? Next question now. A doctor asks a patient about her age. The patient responds, doctor, I am from a village. We were married at a very young age at 12 with my husband, who is just 5 years older than me. Then I had 2 kids when I was around 18 or something. Now I look like their older sister. I am just 32, doctor. What is the most likely diagnosis, most likely thought disorder displayed by the patient? Simple. Giving unnecessary details before the final answer is called as circumstantiality disorder. giving unnecessary details before the final answer. Patient is giving the final answer here. Final answer is given. What about the tangentiality? Answering in a distant related manner. If you ask the patient, who is your favorite actor? Patient will say what? Bollywood is all about romance, Hollywood is all about action. He will never give you the exact answer. That is called a tangentiality. So tangentiality may, you will never get the exact answer, but circumstantiality, giving unnecessary details before the final answer. This one, a young female reports episodes of binge eating followed by self-induced vomiting. She is most likely to have which of the following acid-based disturbances? Binge eating, young female. Okay, this is a case of bulimia nervosa. Bulimia nervosa, binge eating followed by self-induced vomiting. Self-induced vomiting. Yes. So because of the vomiting, now there will be loss of hydrogen ion and chloride. So more and more, so loss of the proton, right now. So more and more acid will be going out. So there will be what? Alkalosis, metabolic alkalosis. We have learned all these, right? Metabolic alkalosis is seen in eating disorder. See, repeatedly asked question, I'm telling you one thing. Eating disorder, how to differentiate anorexia nervosa and bulimia nervosa, right? How to diagnose anorexia and bulimia and pica and binge eating. Repeatedly asked question. So this time they have asked metabolic disturbances. So more and more hydrogen loss will be there, acid loss will be there. So now there will be more alkaline, okay? Metabolic alkalosis. Next question. A lady presents to the hospital after having a fight with her husband. She reports that she is unable to speak. However, all neurological and physical examinations are normal, and she does not seem concerned about her health status. What is the diagnosis? First of all, remember here, unconcerned about the result. Unconcerned about the result or indifferent to result. I have taught you this is called as labile indifference, which is seen in a case of dissociative disorder, which is also called as conversion disorder. Old name hysteria. Old name was hysteria. I hope you are able to recall this. Right. So what is happening here now? Dissociative disorder means what? What is the meaning of dissociative disorder? Psychological stress can produce physical symptoms so that a person can get love, respect, and attention. Okay. And see, a patient of dissociative disorder will be unconcerned about any condition. See, I gave you the example. Suppose if I'm losing one eyesight, I will be in trouble. I would like to see my doctor as soon as possible. Right. But a dissociative case, no. Like if he or she will be losing eyesight, she will say, no problem. I'm having one more eye. She will be least bothered about her blindness. This kind of indifferent to result is called as labile indifference. Labile indifference. Okay. Labile indifference seen in dissociative disorder. Next question. What kind of symptoms does the term affective flattening imply? Affective flattening means what? Flattening of emotion. Flattening of emotion. No change in expression. Okay, we have learned, see, in schizophrenia, there can be positive symptom, there can be negative symptom. There can be negative symptom. So positive symptoms, we have learned that all positive symptoms will be happening because of increased level of dopamine in mesolimbic tract, and negative symptoms will be happening because of decreased level of dopamine in mesocortical tract. Mesocortical tract, right? Okay. What are the positive symptoms? Add-on symptoms. These symptoms were not there before, but now these symptoms are there. Okay, like delusion, hallucination. Negative symptoms means what? Loss of normal function. Earlier patient was very talkative, now patient is no more talkative. Earlier he used to attend all social gathering, but now he is not attending. Okay, easy to understand. So, like avolition, alogia, loss of speech, apathy, loss of interest, asociality, uh, a lack of social activities, right? Affective flattening, anhedonia. All these are examples of negative symptoms of schizophrenia. Okay, we have learned this in detail during the class, right? Okay. What about this question? A 28-year-old woman diagnosed with schizophrenia had been compliant with her prescribed olanzapine for several months. However, she discontinued the treatment. Which of the following is the most likely reason for her discontinuation? Okay. Chalo, we can learn this. When I talk about dystonia, akathisia, and tardive dyskinesia, all these are extrapyramidal symptoms. All these are extrapyramidal symptoms, and these are more common with first generation antipsychotic like haloperidol, flufenazine, and chlorpromazine, or typical antipsychotic. Easy to understand. But see, with the second generation drug or atypical antipsychotic, like example I have given you during the class, mnemonic was Coserac. Okay, C for clozapine, olanzapine, ziprasidone, risperidone, aripiprazole, amisulpride, and Q for quetiapine. See, with the second generation drug, no, most important side effect will be metabolic side effect. Metabolic side effects we are going to see in second generation drug. Like there will be hyperglycemia, there will be a dyslipidemia, weight gain, more sedation will be there, more sedation, and there will be cyalorrhea. Question is, which antipsychotic has the maximum weight gain? First clozapine, then olanzapine. Minimum weight gain or weight neutral, ziprasidone and aripiprazole. Remaining all will be having moderate weight gain. So, say a maximum weight gain is seen with clozapine first, then olanzapine. Okay, so easy to rule out. Answer is because of a weight gain, yes, a person can discontinue. Okay, I hope you people have done great job, and yes, result is out. We have seen that like our medicos have performed exceptionally well. So heartiest congratulations to all of you, and this video will be like very useful for all those medicos who are going to write exam in the upcoming exam in June. Okay, so psychiatry and forensic will always be the scoring subject. Out of psychiatry and forensic, minimum 18 to 20 questions are being framed. Here you will be having more accuracy, right? So this can be game changer for you, right? So thank you so much, and I wish you all the best for all the medicos who are going to write exam in the upcoming exam. Thank you so much. Bye-bye.